Good morning. We'll have a discussion about the emergencies in the oral maxillofacial surgery. There are various emergencies as being present in the case of oral maxillofacial surgery. The commonly occurring medical emergencies in the dental office includes syncope, allergy, asthma, hyperventilation, airway obstructions, seizures, LA overdose, thyroid gland dysfunction, adrenal crisis, insulin shock, and the diabetic ketoacidosis. And we'll have a few discussion about the basic life supports and cardiopulmonary resuscitations and the preventions of the emergencies. Coming to the common medical emergencies in the dental office, as I told it in the previous slide itself, it's unconsciousness. Whenever the patient goes into the unconsciousness, it can be either due to the vasodepressor syncope, orthostatic hypertension, or acute adrenal insufficiency. Respiratory distress, airway obstruction, hyperventilation, asthma, heart failure, altered consciousness either due to the diabetes mellitus, thyroid gland dysfunction, cerebrovascular accident. Seizures, drug-related emergency includes drug overdose reactions, allergy, chest pain, angina pectoris, acute MI, or cardiac arrest. Coming to the syncope. Everyone knows that syncope is nothing but a sudden transient loss of consciousness without the prodromal symptoms is followed within the seconds to the minute, less than a 30 minute, by resumption of the consciousness, usually with a premorbid status. So what are the various synonyms for the syncopes? Common faint, vasodepressor syncope, vasovagal syncopes. So one should know that what are all the predisposing factors for the syncope. It includes psychological factors and the non-psychological factors. Psychological factors includes fright, anxiety, emotional stress, unwelcome news, and the sight of the blood. Non-psychological includes upright position, anger, missed meal, exhaustion, hot, humid, and the crowded environment. How to prevent it? Factors that have reduced incidence, eliminate all the predisposing factors and make sure the patient is comfortable in the dental chair and place a patient in the proper position. Anxiety relief, you can use any questionnaire in case of a adult, or you can use any other technique to make a children comfortable. How the patient presents, what are the manifestations that occurs? Pre-syncope, syncope, and post-syncope. Pre-syncope, one can able to identify when the patient starts to pale, cold sweating, warmth, uneasy, cold extremities, yawning, increased heart rate, blood pressure, depth of respiration, cold extremities. These are all the indicator signs for the patient is going into the syncope. If the patient is in syncope, patient will have a irregular gasping, jerky breathing, apnea, pupils will get dilated, convulsion, heart rate increased, weak pulse, unconscious, airway obstruction might occur. Post-syncope, after the recovery, patient will have consciousness, check the blood pressure, heart rate, and the confusion stage of the patient. What is the pathophysiology present behind the syncope? Anxiety, epinephrine, non-epinephrine increases. It increases the blood flow to the muscles. Cooling of the blood will take place, which causes a decreased cardiac output and decreased blood flow to the brain. Peripheral vasoconstrictions leading to the faint, which is called as a syncope. Management of the syncope includes pre-syncope. If you find that pre-syncope signs and symptoms for the patient, just stop the procedure, place the patient in a proper position. Muscles involvement, aromatic ammonia, so that either an ammonia or sprit cotton can be placed along the nasal region of the patient. That will causes the respiratory stimulant and increase the supply to the brain. Oxygen can be given to the patient, and if the patient is in syncope, position the patient properly. A, B, C has to be carried out. Head tilt, chin tilt. Look, listen, and feel. The cardiac pulse should be palpated. Give an artificial ventilation for the patient and check the proper circulation. Aromatic ammonia, monitor the vitals, loosen the cloths for the patient, and manage the cold for the patient. So coming into the second topic, just called as allergic reaction. Hypersensitive state, allergic reaction is nothing but hypersensitive state occurred through the exposure to particular allergens, re-exposure to the same allergens, which produces the heightened capacity to react. It can be classified into type 1, it is called, I hope everyone knows it in the third year itself. It's called anaphylactic. It's due to the IgE mediated type of a reaction. Type 2 is cytotoxic. Type 3 immune complex. Type 4 cell mediator. So coming into the predisposing factors, either a certain antibiotics, analgesic, anti-anxiety drugs, local anesthetics, prevention, just as a history from the patient, consultations, and then general anesthesia and ischemic blockers like diphenhydramine can be given to the patient. Clinical manifestations, antigen antibody reactions takes place, which in turn causes the stimulation of mast cell, which in turn causes a release of histamine, and turn causes allergic reaction stimulation in gastrointestinal tract, skin, respiratory system, and the cardiovascular system. So this is the clinical manifestations. Respiratory, one will have angioedema, laryngeal edema, asphyxia, bronchospasm, respiratory mucosal edema, chest tightness, dyspnea, and the wheezing. In case of cardiovascular signs and symptoms, circulatory collapse, syncope, tachycardia, hypotension, and even a shock can occur. GIT, one will have cramping, abdominal pain, vomiting, and diarrhea. Whereas in case of skin, one will have urticaria, itching, and angioedema. How to do it? Dental therapy modifications include record the history when the patient is have previous allergic to any antibiotics, drugs. Sometimes a patient will have allergic to latex gloves, local anesthetic, allergic. So everything should be recorded previously before starting any procedure to the patient. If the patient is first and they are newly exposing to these type of an agent, just give a test dose prior to giving anything to the patient in order to avoid this complication. Enter details in patient card, replace allergic drugs, change the route of drug administration. If patient is allergic to local anesthetic, as I told, start with elective dental care. So if there is any elective, you have to do that. Take a proper history and consultation with allergic specialist. Manage a pain infection, considering to do in a general anesthesia rather than that of doing in local anesthesia. Histamic blocker as local anesthetics. So it can be histamic blockers can be used as a local anesthetic agent, which includes 1% of diphenhydramine with 1:1 lakh ratio of adrenaline can be given. Management, if the allergic reaction takes place, what you will do? You should maintain the proper position in order to increase the blood supply to the circulatory systems, in order to increase the blood supply to the cardiac, heart, and as well as to the brain. Immediate severe reaction, just administer the epinephrine 3 ml in 1:1000. Just remember the adrenaline dosage is dilution is different for to be used with local anesthesia and different for to be used with the patient with allergic. 1:1000 ratio in sublingual route has to be given. Histamine blockers, diphenhydramine can be given to the patient. Diphen orally at 6 hours interval for 24 to 48 hours should be given. 1 to 2 milligram per kg if you're going to give in an IV route or IM route. Supplementary oxygen should be given to the patient. Corticosteroids can be given because steroids is a very good anti-inflammatory actions. Either you can give an hydrocortisone injections can be given. And if the patient is in severe condition, hospitalize the patient and give the drugs in an IV route. Coming to the third emergency, it's acute asthmatic attack. It's a disease which is characterized by increased responsiveness of trachea and the bronchi to widespread narrowing of airways. The changes in severity either spontaneously or as a result of therapy. It includes extrinsic and intrinsic status asthmaticus causes, a pollen grains, dust, moles. Clinical features will be wheezing, coughing, dyspnea, fights for air, and the cyanosis. Cyanosis is just nothing but bluish discoloration. It's due to the entry of carbon dioxide in the blood. Dental treatment includes use of stress reduction protocol, nitrous oxide sedation, 9 to 15% are patients are sensitive to aspirin, so just avoid it. Management, if asthmaticus occurs, you should terminate the treatment, position the patient, calm the patient, administer oxygen, aminophylline 0.5 to 1 milligram per kg per hour for 10 minutes. IV infusion should be given. Medalar or 0.01 milligram per kg of 1:1000 dilution of epinephrine subcutaneously. Hydrocortisone sodium succinate 100 mg per kg should be given intravenously. Coming into the hyperventilation, ventilation in excess of that required to maintain a normal PO2. Etiology, psychogenic or organic causes. It is very rare complication, but remember it. Anxiety will lead to hyperventilation, which in turn lead to increased respiratory rate, tidal volume, hypocaribia, so decreased carbon dioxide level in the blood, lead to the vasoconstrictions of arteries of the brain, which lead to the reduced blood supply to the brain. Cause may be an anxiety. Clinical features is unaware. Patient will not be aware of it. Tightness. Sometimes the patient will have numbness, twitching, cramping, seizures, and unconsciousness will occur. It's very rare in case of a children. Just monitor the vitals and the respiratory rate. One can able to conclude it's hyperventilation. What to do? Hyperventilation. Since the carbon dioxide level is very low, early recognition. Just terminate the procedure and place the patient in a proper position. Definitive treatment should be given to the patient. Remove any of the material just present in the mouth in order to prevent the aspiration. Reassure the patient everything will be all right within a few minutes, and make a patient to breathe slowly. Rebreathe the exhaled air. You have to ask the patient to breathe in a cover so that patient can able to breathe the carbon dioxide and as well as the oxygen. So rebreathe the exhaled air. In case if you're going to give a drug, just give a diazepam or a midazolam. Thank you. In next class, we will see about the remaining complications because it's very tough to cover everything in a single stretch and it will make you people to get bored. So in upcoming class, we'll have a small discussion about the remaining starting from the airway obstruction.